Hi friends, welcome to Pharmacology, antibiotic medicine for second year medicos. Today in this video we are going to discuss about fluoroquinolone group of antibiotics. Okay, or they are also known as quinolone antimicrobials. Okay, fluoroquinolones or quinolone antimicrobials. Okay, firstly moving on to classification. The quinolone antimicrobials are basically divided into two groups based on the fluorine content. They are non-fluorinated quinolone antimicrobials and fluorinated quinolone antimicrobials. Okay, the first developed quinolone antimicrobial was nalidixic acid, which was actually non-fluorinated. So, coming to fluorinated quinolone antimicrobials, they are known as fluoroquinolones. Okay. Quinolone antimicrobials which are fluorinated, they are known as fluoroquinolones. So they are basically divided into two generations, first generation and second generation. They are first generation and second generation. What are the examples of first generation fluoroquinolones? The examples are ofloxacin, norfloxacin and pefloxacin. Okay, fluoroquinolones basically end with oxacin. Okay, oxacin. The examples are ofloxacin, norfloxacin, pefloxacin. So moving on to second generation. The examples are levofloxacin, gemifloxacin and prulifloxacin. So two generation examples are this. All of them ends with fluoroquinolones ends with oxacin. Okay. So that is first part. So coming to next heading of a drug, we are going to write any drug under classification, mechanism of action, pharmacokinetics and pharmacodynamics, pharmacological action, use and adverse drug reaction. Okay, so moving on to mechanism of action, they are basically inhibiting two enzymes. So based on the gram staining produced by the bacteria, in gram negative bacteria they inhibit topoisomerase 2 enzyme. The name of enzyme is topoisomerase 2. Gram negative bacteria inhibit gram negative bacterial growth is inhibited by the enzyme topoisomerase 2 inhibition. Then gram positive bacterial growth is inhibited by topoisomerase 4 inhibition. So how will you remember this? Positive for 4. That means you remember like PS4. PS4 means positive staining producing bacteria inhibit 4th. PS4 means PlayStation 4. So boys can easily remember PS4. Positive staining inhibit topoisomerase 4 enzyme. So by the inhibition of this enzyme, they inhibit DNA synthesis. Okay. By the inhibition of this enzyme, they actually inhibit DNA synthesis. This DNA synthesis inhibition produces bactericidal action, that is pharmacological action of fluoroquinolone. Okay. So that's about pharmacological action. So then pharmacokinetics and pharmacodynamics. Our regular 4 points are there. Administered orally and sometimes parenterally. Absorbed after plasma protein binding. Metabolized in liver, excreted in urine and small quantity through feces. So these are the 4 common points which we write under pharmacokinetics and pharmacodynamics. So moving on to use and adverse drug reaction. So there is specific mnemonic which contains both use and idea. The mnemonic is athlete Shankar from Andhra got diabetic foot. So mnemonic is athlete Shankar from Andhra got diabetic foot. So what is the adverse drug reaction? The basic adverse drug reaction producing by the fluoroquinolone is on musculoskeletal system of human body. So in athletes it produces tendon rupture and tenosynovitis. From the word athlete, in athletes it produces two side effects, tendon rupture and tenosynovitis. In children also there will be weakening of musculoskeletal system. So musculoskeletal system adverse drug reaction is specific for fluoroquinolone group of antimicrobials. So moving on to uses, there are 3 uses under this mnemonic. Shankar from Andhra got diabetic foot. Athlete Shankar. Who is Shankar? Shankar is an athlete. Okay. Shankar means sangroid. Andhra means anthrax. Anthrax bacilli forming zoonotic disease, anthrax. Chancroid is a sexually transmitted disease caused by Haemophilus ducreyi. Then diabetic foot. To treat anaerobic infections in diabetic foot. Okay. To treat anaerobic infections in diabetic foot. In diabetic foot there will be reduced blood supply due to microangiopathy produced by diabetes. So there will be anaerobic infection common in diabetic foot. To treat them also we have using fluoroquinolone group of antimicrobials. So that is end of discussion. Let's conclude. Firstly, classification: non-fluorinated, first generation, second generation. Okay. So PS4 positive, 4 negative, 2. Then PKPD regular points. Then bactericidal due to DNA synthesis inhibition. Then uses and adverse drug reaction from pneumonic. Athlete Sanger from Andhra got diabetic foot. So that's conclusion about fluoroquinolone. So that's end of discussion of fluoroquinolones. Thank you and have a nice day.